Hi, I'm Daniel, and this is blog 3 about the leadership skills. Um, After doing the questionnaire, surprisingly, I was pretty even throughout the three different areas of or types of leadership. Um, for my administrative and interpersonal skills, they were both at a 20, and my conceptual skill was at 24. Um, this ranks me highest at the conceptual skill, which was kind of surprising to me because I would think of myself more as an interpersonal leadership type. But as far as the conceptual skills, from what I've learned, is that they allow a manager to visualize the entire organization and work with the ideas and relationships between um, different concepts within the organization. Um, as far as the first question of what skills in Grohar Murray and Langon's chapter 7 that I would identify with to help things such as staffing and other issues would be to planning, organization, and coordinating. These things are really important when it comes to managing, and as far as staffing goes, as the question infers, is that you would have to do some planning for the next shift ahead, and you'd have to be organized to go through with the planning and be able to pull strings and make things happen, whether that's floating other nurses or doing what you need to do to get staffing um, correct. And then you'd have to coordinate that throughout the different units. In the questionnaire, as far as a conceptual leadership style, things I would use was problem solving and addressing issues immediately and seeing the big picture. Um, we can do this through bed meetings where every unit comes together twice a day or twice a shift. I guess it would be 4 times a day to figure out what the staffing needs are in each unit and figure out where to pull people if needed. As far as published literature, um, evidence-based practice is used throughout nursing. Everybody knows that. And using evidence-based practice for transdisciplinary care models is important when you're a manager. There's an article I found that was a qualitative analysis, and it was titled Transdisciplinary Care in the Emergency Department. And basically, it breaks down the importance of the transdisciplinary team and the care that patients get, and it concludes that patients get better care and the throughput of the ED improves when using this model. With this literature, I would advocate for more education amongst the interdisciplinary team members of my organization to make the hospital run more effectively. For question number 3, identify levels and departments that you will need to work with in order to be effective in your role. I'm an ICU nurse, so in order to be an effective manager in the ICU, there are many departments that need to be involved because critically ill patients need many resources and lots of teamwork to progress effectively out of the ICU and into recovery and further on. The teams include the doctors, obviously, and the staff nurses, but outside of that core of team members, we need care managers, social workers, all the therapies like speech, occupational, physical therapy. We need the lab, pharmacy, nutritionists, and many other team members. Having members of every level in all of these departments familiar with any policy changes or just the policies in general, and especially ones that are directly involved in patient care, it's imperative to being effective as a unit leader. And then for question 4, it says, explain if you feel you have a preference between vertical and horizontal structure. Personally, I don't think I have a preference with either vertical or horizontal structure. I think they both are needed in different levels of every organization for an organization to work properly. I mean, there are things where vertical structure works well as far as having that level of hierarchy and more structure as far as somebody telling somebody what to do and what needs to be done, but in a horizontal structure as far as expanding out and using interdisciplinary team members to split up jobs or tasks is also very important. So I think they both work well together, and I don't think one versus the other would be more effective. And as far as a particular model that I would lean to, I think would just have to be the organizational model. That way, it kind of lays out the grounds of the organization, so it gives you a basis of who you hire and who you work for. That's it.